Hello everyone, my name is Mark Schall. I'm an assistant professor of industrial and systems engineering at Auburn University, where I am also a faculty member in the Center for Occupational Safety, Ergonomics, and Injury Prevention. Today I'd like to spend some time describing the results of a recent study we conducted at Auburn entitled Aluminet, a potential intervention for heat-related illness among construction workers. Before I begin describing the study, I'd like to first acknowledge our sponsor, CPWR, the Center for Construction Research and Training, which is funded through a cooperative agreement with the National Institute for Occupational Safety and Health. Thank you very much to our sponsor. It's important to note that the contents of this presentation are solely the responsibility of the authors and do not necessarily represent the official views of CPWR or of NIOSH. In addition, I'd like to acknowledge my co-authors. Richard Sussick is an associate professor of industrial and systems engineering in the College of Engineering at Auburn University. David Pascoe is a professor of exercise science in the School of Kinesiology at Auburn. And Lauren Rennan is an assistant professor of building construction in the College of Architecture, Design, and Construction at Auburn University. In addition to these professors, I'd like to thank Connor Lusk, Swinshwin Zhang, Mohammed Badwi, and Sarah Cressman, 4 students in the Industrial and Systems Engineering Department that contributed to different aspects of this project. Thank you all for your help. So to begin, environmental heat exposure and associated heat-related illness is a substantial problem in the United States. Heat-related illness accounts for approximately 658 fatalities each year, and it's particularly problematic in the deep south region of the country, where high humidity levels and high temperatures, particularly in the late summer months, contribute to a very dangerous situation for many people and particularly workers who are operating outside. From 2000 to 2010, 359 worker deaths were attributed to heat exposure, according to recent data from the United States Bureau of Labor Statistics Census of Fatal Occupational Injuries. Construction workers are particularly susceptible and have the second highest annual rate of heat-related mortality at 1.13 deaths per 1 million workers. They also had the highest worker compensation claim incidence rate at 12.1 claims per 100,000 full-time equivalent workers. While best practice guidelines do exist for preventing work-related heat-related illness, such as the American Conference for Governmental Industrial Hygienists threshold limit values and action limits, there's really a lack of effective interventions for combating heat-related illness. And the heat stress management typically becomes based on monitoring and training workers to employ protective behaviors like hydrating, self-pacing, taking advantage of shade when available, and so forth. For this reason, the Occupational Safety and Health Administration, OSHA, has recently published several heat-related prevention training guides, as well as developed a recent initiative to combat this issue of heat stress management and appropriate training of workers. Aluminet is a mesh material that's made of a metallized high-density polyethylene thermoplastic. It is typically used in shade cloths and greenhouses and has been shown to reduce greenhouse temperatures by about 10%. Because of its metallic silver color, it's very reflective and highly visible. And for that reason, our research team, and because of other past experience using the material in other applications, thought that the technology might be able to be applied as a new form of personal protective equipment for construction workers who are operating outside. For that reason, we applied for this project and were selected to evaluate the efficacy of reflective Aluminet vests as an intervention for reducing exposure to environmental heat stress among construction workers who are working outside in the field. For this study, we employed a repeated measures field-based exposure assessment design involving 15 healthy, acclimated construction workers. For 2 full workdays, each participant was observed performing their typical work procedures while temperatures exceeded 85 degrees Fahrenheit, at least at one point during the day. Each participant wore an Aluminet vest on one workday and a conventional safety vest on the other. The Aluminet vest was a 50% weave, meaning that it alleviated about 50% of the radiant heat load throughout the day. A trained observer shadowed each participant throughout the day and recorded the time to the nearest minute that the worker completed specific activities, including taking drinks of water? Were they working in the sun? Were they working in the shade? Were they working with hot equipment? And so on and so forth. Overall, the study sample, as we said, was 15 participants, 7 of which were healthy poured concrete foundation workers, and 8 were healthy landscaping and building maintenance workers. The average age of the study sample was 33 years. They had an average weight of about 220 pounds, a height just shy of 6 feet tall at 70.5 inches. Their body mass index was 31 kilograms per meter squared. 14 were right-handed and 1 was left-handed. The workers were observed doing a series of different activities. The poured concrete workers spent the majority of their time pouring concrete and developing footers for a new building that they were constructing. In addition to pouring concrete and spreading it throughout the day, they would also help develop different rebar structures that were being built into the concrete structure. As far as the landscaping workers, the majority of the work involved spreading mulch, doing different lawn maintenance activities, and some workers even placed sod while they were conducting their work. Our measures included heart rate, which was measured using a heart rate monitor chest strap worn around the torso. Along with the heart rate monitor, an eye button skin temperature sensor was secured to the heart strap and was making contact with the skin. A physical activity monitor was worn on the dominant hip of each participant, which logged the heart rate data from the chest strap as well as collected accelerometer information, which we could use to estimate energy expenditure while the workers worked. In addition to those other direct measurement methods, we use a Braun thermoscan to measure core body temperature, which we assessed roughly every 30 minutes. Along with the core body temperatures, we also collected ratings of perceived exertion using the Borg CR10 scale. We used a 10 centimeter visual analog scale to collect information on thermal comfort or discomfort and perceived wetness every time that core body temperature was assessed. At the end of each work shift, each worker completed a fatigue assessment scale for construction workers to assess their level of fatigue at the end of the day, and that was delivered immediately following their shifts. Once we collected all of our data, the statistical analysis involved performing standard analytic tests for the normality of the distributions. For parametric data, we described the data using mean and standard deviation. For non-parametric or non-normal data, we described that information using the median and interquartile range. We used paired t-tests, which were two-tailed, to estimate the effect of experimental condition. The experimental condition being use of an Aluminet vest versus a conventional vest on each of the summary measures for their parametric data. And we used a Wilcoxon sign rank test to assess self-reported fatigue estimates and to look at continuous summary measures that were non-parametric. All of our comparisons were planned a priori, therefore no adjustment was made for multiple comparisons. That is, each comparison was evaluated for statistical significance using a p-value of 0.05. For the parametric results, you can see that in general, each of the participants wore the Aluminet vest and the conventional vest for a similar amount of time, about 8.5 hours. The work that was observed was relatively consistent between the work days. Whether you were wearing the Aluminet vest or the conventional vest, you burned just slightly over 1,000 kilocalories and approximately 1.5 METs. The percentage of time conducting moderate or vigorous physical activity was roughly 20% in each condition. No statistically significant differences in any of those measures. As far as heart rate, we did see a reduction of heart rate of about 5 beats per minute while wearing the Aluminet vest. This had a p-value that was approaching statistical significance. However, it was not statistically significant using an alpha of 0.05. Skin temperature, again, was very comparable between each day. The Aluminet and conventional were both at about 93 degrees Fahrenheit, and wetness and average Borg ratings were also very consistent between the 2 days, suggesting that the Aluminet vest did not appear to have a an effect on reducing their overall comfort or a reduction in effort. As far as the non-parametric results, it's important to note that we also collected wet bulb globe temperature while on the work site, and we could see that on average, the average temperature was about 85 degrees on both work days. Similarly, relative humidity was very consistent between the Aluminet and the conventional work days. The outdoor maximum temperature was about 92 degrees on each work day. Typically, when workers would begin the work shift, it would be somewhere in the 70 degree range early in the morning, 5, 6 o'clock in the morning, and the workday would end sometime around 2 or 3 in the afternoon, depending on what they were doing. That would usually be when the temperature would max out somewhere around 90 to 95 degrees. Looking at data from the National Oceanic and Atmospheric Administration Center close to the worksite locations, we could see that the WGBT measurements were pretty consistent with what the NOAA reported, which was about 91 degrees. Core temperature readings that we measured with the Braun thermoscan were essentially the same, whether wearing the Aluminet vest or the conventional vest, at about 98 degrees, as it was thermal discomfort when measured using the visual analog scale. In addition to those results, it's important to note that the Aluminet, that participants reported less fatigue after wearing the Aluminet vest. This is total fatigue as well as a lethargy subscore and a body ailment subscore of the FACSW. However, these effects were not statistically significant. In general, the results suggest that the Aluminet vest, at least the 50% weave that we evaluated, did not appear to be an effective intervention for reducing exposure to environmental heat stress. Having said that, there were several limitations to our study. One was that we did not use a gold standard core temperature pill throughout conduct of the study. That was our initial intention. Unfortunately, there were liability concerns from the employers of the workers who were participating in our study, so we could not use the core temperature pills. The Braun thermoscan has a good accuracy. However, it would have been very nice to have used the core temperature pills to get a more accurate reading. As far as the timing of the work shifts, in general, all workers worked from into the heat. They worked from the very early morning hours until sometime in the mid to late afternoon. The timing of the work shifts helped some of the workers avoid some of that direct sun and heat that seemed to be greatest at about 2 to 3 p.m. in the afternoon. In particular, landscaping workers had more opportunities to escape the sun and heat than the poured concrete workers, and this was in part because of their work shift length. They were mostly done by 2 p.m. in the afternoon. In addition, they had work trucks that they could escape and get some time in the shade or air conditioning more often than the poured concrete workers, who were really dependent on the activities that were occurring on the work site. Practical implications of this study. While Aluminet vests were not shown to be effective in this study, there still may be other interventions that may work for preventing heat-related illness among construction workers. These include things like cooling vests, other hybrid material construction uniforms. More research should be devoted to those aspects. In addition, early warning systems that may use, say, wearable technologies to assess potential changes that might be occurring physiologically on the workers. They might be effective, and also may help employers determine optimal recovery times, work rest habits that need to be applied to help prevent the development of heat-related illnesses. Of course, promoting hydration, education, and awareness has shown to be relatively effective and should be continued until more effective interventions may be developed. Additionally, as I said, Aluminet, while it was not shown to be effective in the current study, it does not mean that it might not be effective as used in other applications. Traditionally, Aluminet is used as a shade tent, and it may be an effective intervention on a construction site as a shade tent, more resources should be devoted to considering how Aluminet may be used in other applications. At this time, I thank you for your attention. My contact information is on the screen. Feel free to reach out if you'd like any more information on the study or other work that we are doing at Auburn University. We'd be very happy to discuss potential opportunities to collaborate as well as to describe more of the research that we're conducting. Finally, here are the references for the presentation, and I thank you very much for your time.